there, deep diver. Ready to jump back in time with me?
Always. Where are we headed?
Back to the very beginning, February 2020, to a report that I think it really captures that moment when the world was grappling with COVID for the first time.
Oh, yeah. The WHO-China Joint Mission Report.
That's the one, a real time capsule.
It is fascinating to look back at it now.
25 international experts, 9 days in China. They were in the thick of it. Hospitals, labs, you name it.
Working alongside their Chinese counterparts.
Exactly. So if you're like me and you sometimes need to, refresh your memory on how it all began, this is the deep dive for you. We're going to unpack those key findings and what they meant back then.
It's amazing how much has changed and how much we've learned.
I know. Okay, so let's start with the virus itself. Rewind to December 2019, Wuhan, China. A cluster of pneumonia cases, cause unknown.
Mysterious at the time, but sounds all too familiar now, right?
Right. And then, boom, scientists identify this brand new virus.
A beta coronavirus.
96% similar to a virus found in, you guessed it, bats.
Bats seem to always be involved somehow.
They do, although the intermediate host, the animal that bridged that gap between bats and humans, well, that's still a mystery.
Still a big question mark.
Big implications for preventing future outbreaks, too. Now, the report also mentions this thing called 99.9% homology among those early virus strains.
Okay, so that basically means those early strains, genetically speaking, were almost identical.
Ah.
So in those early days, developing a vaccine or treatment had a much higher chance of being broadly effective, at least compared to later on when we saw those variants pop up.
So that's what they mean by a stable virus, huh?
Exactly.
But how contagious was the stable virus? I mean, the report has those, those epidemic curves showing the cases over time, and they're pretty...
Dramatic.
Yeah, dramatic.
Yeah, especially in Wuhan. Cases skyrocketed from January 10th to the 22nd, then peaked around the 23rd to the 27th. Then you start to see a steady decline.
Wait, but what about that spike on February 1st?
That was just a reporting change.
Oh, a reporting change.
Yeah, not an actual surge in infections.
Those reporting quirks can really mess with your perception, can't they?
They really can.
The report actually distinguishes between two systems. The National Reporting System, or NRS, and then the Infectious Disease Information System, or IDIS. One gave daily totals, and the other was more real-time data.
Right. It's important to keep those differences in mind when you're looking at those early numbers.
Okay, so we've got a stable, highly contagious virus, likely originating from bats. But how exactly was it spreading? The report gets into transmission dynamics and breaks it down into, 4 different types, right?
Yes, and some of them are surprising.
Way on me.
Okay, so first you have that initial rapid spread in Wuhan, with an R0 or R0 between 2 and 2.5.
Okay, pause for a second. What exactly does R0 mean again?
It's basically a measure of how contagious a disease is. So an R0 of 2 to 2.5 means each infected person was, on average, spreading the virus to 2 to 2.5 other people.
Got it. Continue. So Wuhan, rapid spread.
Right, and that R0 of 2 to 2.5 is significant.
Yeah, because, you compare that to measles, which is one of the most contagious diseases out there, right?
Measles has an R0 of 12 to 18.
Wow.
But then the seasonal flu, that usually has an R0 of around 1.3.
So COVID was somewhere in between, but definitely on the highly contagious side, even in those early days.
Absolutely.
Okay, what about those other transmission types?
So the second type was the spread in areas surrounding Wuhan. It was less intense there, likely due to lower population density and fewer connections to the city itself.
Makes sense. What about outside of Hubei province?
Okay, so that's the third type. Limited community spread, mostly family clusters.
Okay.
And here's the surprising part. The R0 in those clusters was also 2 to 2.5.
Wait, really? So even outside of Wuhan, where things were less intense overall, those close contacts within a household, they were still driving significant spread.
Exactly. Close contact was a major factor.
That's important to know when you're thinking about things like travel restrictions, right? How effective are they really if the virus is spreading so easily within households?
Yes.
Okay, what's the fourth type?
The fourth type involves specific settings, like healthcare facilities and prisons. Interestingly, these weren't major drivers of the outbreak in those early days, though there were some isolated incidents, especially in healthcare settings, where exposure risk was just higher.
Okay, so that makes sense. The report also gets into contact tracing data, with some specific examples from Shenzhen, Sichuan, and Guangdong.
Yeah, and that data shows how important contact tracing was for identifying chains of transmission and containing the spread.
Tell me more about that.
For instance, in Shenzhen, they were able to trace 100% of identified close contacts.
100%. That's impressive.
It is, and of those contacts, only 2.8% ended up testing positive.
Wow.
That really shows you the power of swift action and isolating those who might have been exposed to break the chain of transmission.
Now, I remember reading about something called ILI and seri samples. What were those about again?
Ah, yes. ILI stands for influenza-like illness, and SERI for severe acute respiratory infection. So by testing these broader categories, they were casting a wider net.
Not just looking for COVID specifically, but trying to see if it was circulating undetected in people who might have had different symptoms.
Exactly. And thankfully, they found very little community spread that way.
Like in Wuhan, they were testing ILI samples regularly in late 2019 and early 2020, but no positive results popped up until that first week of January.
It seems like they had a pretty good handle on the virus's movements.
Okay, so we've got a handle on transmission, at least to some extent. But what about kids? Weren't we all worried about kids being like little super spreaders?
Right, kids are notorious for spreading the flu, but thankfully it wasn't the same story with COVID, at least not at that point.
Really?
The attack rate in children was remarkably low, only about 2.4% of reported cases.
Wow.
And even more surprising, there was very little evidence of child-to-adult transmission.
So different from other respiratory viruses.
Very different.
That was definitely a relief, but I also remember it being really puzzling at the time.
Okay, so we've talked about transmission, but how sick were people actually getting? The report says it wasn't just about those severe cases making headlines, right?
Right, most people experienced mild to moderate symptoms.
So what were the common symptoms back then?
Well, the incubation period was typically 5 to 6 days, and the symptoms, they ranged from fever and dry cough to fatigue. Some people even experienced nausea or diarrhea.
It really was a mixed bag of symptoms, huh? Making it hard to diagnose.
Exactly, it wasn't always clear-cut.
Okay, but in terms of severity, break it down for me.
Okay, so about 80% of cases were mild or moderate, meaning they didn't develop severe pneumonia.
That's good news.
However, about 13.8% of cases were classified as severe.
And 6.1% is critical.
Right.
So what's the difference between severe and critical?
Severe involved more serious respiratory issues, like shortness of breath and low blood oxygen levels. Critical cases meant respiratory failure, septic shock, or multiple organ dysfunction. Okay, so those critical cases were the ones landing people in the ICU.
Exactly.
But the silver lining here is that even with those severe and critical cases, most people recovered.
Most people did recover.
That brings us to China's response, which, from what I remember, was pretty intense.
It was. Swift and multifaceted.
They didn't waste any time.
Their approach definitely evolved as they learned more about the virus, but some key elements stayed consistent throughout.
Like what?
Well, early identification and isolation of cases was crucial. They also implemented rigorous contact tracing and quarantine measures.
They weren't messing around.
And then there were those social distancing measures on a massive scale.
Like what? Give me an example.
Well, remember they extended the Spring Festival holiday to keep people at home?
Yeah.
And then there were all those travel restrictions, both within China and internationally.
It was a completely different world back then.
Okay, but this whole collective action thing, it sounds, I don't know, a bit too good to be true. Were there any dissenting voices at all, or were people really just going along with everything the government was saying?
Well, the report focuses mainly on the official response and doesn't delve into any dissenting voices or challenges they might have faced implementing these measures. It's important to remember this was just a snapshot in time.
Right.
Our understanding of the pandemic has evolved so much since then.
That's a good point. Okay, so they mobilized resources, but what about the human element? Like, what was the mood like in China during those early days?
The report really emphasizes their commitment to this idea of collective action and the sacrifices people made to protect themselves and their communities.
That's pretty remarkable, especially when you compare it to, some of the responses we saw in other countries that were more focused on individual freedom.
It definitely raises questions about different cultural approaches to public health crises.
It does. It does. And speaking of different approaches, one thing the report makes very clear is that COVID-19 is not SARS or influenza.
It's its own beast.
Exactly. Comparisons can be misleading. And to develop effective strategies, we have to understand its unique characteristics.
So what were some of the key takeaways for the rest of the world? Like for those of us who were watching all of this unfold and trying to make sense of it?
Well, first and foremost, they emphasized that understanding the true nature of this virus was crucial. It's highly contagious, and it can have very serious consequences, especially for certain groups.
It's not something to be taken lightly.
Not at all. Second, they stress the importance of acting decisively. Early detection, isolation, and contact tracing are absolutely vital for containing outbreaks.
Okay, so being proactive is key.
Absolutely. And third, they highlighted how important reliable information and community engagement are in a situation like this.
Because if people don't trust the public health authorities or understand the guidelines, then it's going to be much harder to control the spread.
Exactly.
Yeah.
Trust and a willingness to follow those guidelines can make or break a response.
So much to consider. It's amazing how many of those early lessons are still relevant today.
They really are. But the report doesn't just highlight what we knew back then. It also dives into the big unknowns, the things we still needed to figure out. And that's where we'll pick up in part 2 of this deep dive.
Stay tuned.
Welcome back, Deep Diver. Back for more.
Always up for a deep dive, especially when we're talking about the early days of COVID.
Last time, we were looking at how China responded in those first few months of 2020. And it was really,
This is impressive.
it was like watching a nation mobilize against this invisible enemy.
But even with their quick action, so much about the virus was still a complete mystery. And this report, it doesn't shy away from that. It actually dedicates a whole section to, what we needed to learn to fight this thing.
It's almost like a roadmap for future research, which, knowing you,
Oh, I love a good roadmap.
it lays it all out there, no sugarcoating.
So let's talk about those knowledge gaps. What were some of the biggest mysteries back then?
Well, it starts at the source of the virus. We knew bats were likely involved. But that missing link, that intermediate host, well, it was still out there.
So even with all the work China was doing, we still didn't know how it actually jumped to humans. And finding that missing link, it's crucial, right? Not just for understanding this pandemic, but for preventing the next one.
Absolutely. The report really stresses that investigating those very first cases, the places where humans and animals interact, those initial exposures, it's all incredibly important.
It's like detective work, but on a global scale, and the stakes are incredibly high.
The stakes couldn't be higher.
And speaking of high stakes, the report also dives into
The pathogenesis and virulence of the virus.
yes,
Yeah.
basically like how it causes disease and why some cases are so severe.
Right, because early on, it was clear that COVID wasn't a one-size-fits-all kind of disease. Some people had very mild symptoms, while others ended up critically ill.
They're the real mystery.
And understanding why was crucial for predicting who was most at risk and how to manage those severe cases.
And I remember all the debate about how the virus was actually transmitted.
Oh, yeah. The report goes into some pretty technical details about transmission dynamics.
Like what?
Well, they were still trying to figure out the role of aerosol transmission,
Hmm.
whether it was just those respiratory droplets or if it could linger in the air.
I remember that being a big question.
And then there were questions about fecal-oral transmission. And they were mapping the patterns of viral shedding, which is basically when and for how long people were contagious.
So much basic information was still missing.
It made developing those public health guidelines incredibly difficult.
I can imagine. Think about it.
Mhm.
To decide on isolation protocols, to develop testing strategies, they needed to know what bodily fluids even contained the virus, how long people were contagious, whether asymptomatic people could spread it.
It was like trying to build a house without knowing what the foundation was made of.
Perfect analogy. And then there's the whole question of risk factors, like what made some people more likely to get infected in the first place.
Right. Were there genetic predispositions, behavioral patterns, socioeconomic factors?
So many unknowns. The report also talks about surveillance and monitoring, which makes sense, right? You need to know how to track this brand new virus in real time and catch those silent chains of transmission.
Absolutely. And the report really emphasized leveraging those existing surveillance systems for things like influenza-like illness and severe acute respiratory infections.
The ILI and seri samples we were talking about earlier.
Exactly. Those systems were already in place, collecting data from hospitals all over.
So they were building on what they already had.
It was a smart approach.
The report also mentions the importance of developing accurate and reliable diagnostic tests.
Well, yeah, because in those early days, confirmed cases relied on PCR testing, which is the gold standard, but it wasn't readily available everywhere, and it took time to get those results back.
So it wasn't a perfect system.
No, and researchers were already working on those faster and more accessible tools, like antigen and antibody tests.
Okay, that makes sense. And on the treatment front, there were no proven therapies for COVID at that point.
Right, doctors were relying on supportive care, managing symptoms, providing oxygen.
I remember that feeling of helplessness, just hoping for some kind of breakthrough.
The report really highlights how urgent it was to get clinical trials up and running. They needed to evaluate potential antiviral drugs, immune-based therapies, even convalescent plasma from recovered patients.
And then there was the race for a vaccine.
The ultimate solution, but development was still in those very early stages.
So many questions. Which platform would work best? What kind of immune response would actually provide lasting protection? How do we make sure it's safe?
It was an unprecedented mobilization of scientific resources, all driven by this global sense of urgency.
It's mind-boggling to think about all that research being launched while healthcare systems around the world were being pushed to their absolute limits. And it wasn't just about the science either. The report recognized the social and economic impacts of the pandemic too.
It was clear from the beginning that this wouldn't just be a public health crisis. It would affect everything: global supply chains, travel, education, employment, even mental health.
It was a wake-up call to the fact that this was going to be a test of resilience, not just for healthcare systems, but for societies as a whole.
And those predictions, sadly, they were spot on.
So let's talk about some of those economic and social challenges. I remember reading this report and just feeling this sense of dread, like things were about to change in a big way.
Yeah, and one of the biggest concerns was the global economy. Think about it. China, the world's second largest economy, was essentially shutting down to contain the virus.
Factories were closing, businesses were shutting down, travel restrictions were rippling across the globe.
It was a domino effect.
And I think that's when it really hit home for a lot of people, that this was going to have a very real impact on their lives.
The report anticipated all those disruptions to supply chains, the decrease in consumer spending, all the volatility in those financial markets.
And we saw it all play out. Stock markets plummeted, unemployment rates skyrocketed, businesses were struggling to stay afloat.
It really exposed how interconnected and fragile the global economy was.
It did. The report also predicted those widespread job losses and all the economic hardship that would follow.
As businesses were dealing with lockdowns and reduced demand, layoffs and cuts to working hours became inevitable. And those sudden losses of income hit families hard, especially those who are already living paycheck to paycheck.
It really highlighted the importance of those social safety nets and whether they were strong enough to support people through this.
Absolutely. It exposed those vulnerabilities. And it wasn't just adults who were affected.
What about kids?
The report also looked at the disruption to education.
With schools and universities closing down, millions of students suddenly had to shift to remote learning.
It was a huge adjustment, and it came with a whole host of challenges. Access to technology, the lack of social interaction, the difficulty of replicating those support systems that are so crucial for learning.
I remember those early days of remote learning, the scramble to get kids online, the teachers trying to figure out how to engage students through a screen. It wasn't easy for anyone.
And it was even harder for students from disadvantaged backgrounds, those who might not have had the resources or support to thrive in that kind of environment.
The pandemic really exposed the inequalities that already existed in education.
It really highlighted the digital divide and the need for equitable access to those learning opportunities.
And it also made us question what education should even look like. How do we balance the need for safety with the importance of social interaction, of in-person learning?
Well, it's a question we're still grappling with.
And then there's the impact on mental health.
Oh yeah, that was a major concern highlighted in the report.
All the fear, the uncertainty, the isolation.
It took a toll on everyone's well-being.
People were anxious about their health, their jobs, their families, the future in general.
It was, and still is, a collective trauma.
It is. It really is. And the report, it recognized the need for mental health support services, especially for those frontline healthcare workers, those dealing with job loss or financial strain, those vulnerable populations.
It's a reminder that pandemics don't just affect us physically, they affect us emotionally and psychologically as well.
So looking back at this report, it really painted this accurate, if a bit sobering picture of the challenges that would come with the pandemic.
Almost like a roadmap of the difficult path ahead.
A roadmap. But it wasn't just about highlighting the problems, was it? There were also those recommendations for what to do about them.
That's where we'll pick up in part 3. We'll explore those recommendations and what they meant for China, for countries facing those imported cases or outbreaks, for those uninfected countries, for the public, and for the global community as a whole.
Welcome back to the Deep Dive. It's hard to believe we're still talking about this report from early 2020. It's packed with so much. And we've covered those early mysteries about the virus, China's response, those looming unknowns.
It really shows how far we've come, how much we've learned since those early
But
days.
also how those early days really shaped, well, everything that came after. And one of the things that's become crystal clear is that this pandemic, it wasn't just a public health crisis, it triggered this whole cascade of economic and social consequences.
And the report saw that coming.
They did. It wasn't just focused on the virus itself. They acknowledged right from the start that this could disrupt everything: global supply chains, travel, education, employment, mental health.
They were warning us that this was going to be a real test of our resilience.
Not just for healthcare systems, but for societies, for everyone.
Exactly.
And those predictions, unfortunately, they turned out to be pretty accurate. So let's unpack some of those economic and social challenges. I remember reading this report and just feeling, well, a lot of dread.
It was a scary time, a lot of uncertainty.
It was, and it felt like things were about to change drastically.
One of the biggest concerns was the global economy. China, the world's second largest economy at the time, was essentially shutting down to contain the virus.
Factories were idling, businesses were closing, those travel restrictions were affecting everyone.
It was unprecedented.
I think those images of those empty factories, that's when it really hit home for people that this was going to have a real impact on their lives.
Absolutely. And the report anticipated all of that.
Mm.
Disruptions to supply chains, decreased spending, volatility in the markets.
And we saw it happen. The stock markets plummeted, unemployment went way up, so many businesses struggling to survive.
It really revealed just how interconnected and fragile the global economy was.
It did. It did. The report also predicted widespread job losses and economic hardship, right?
Yeah, I mean, businesses were grappling with those lockdowns and reduced demand, so layoffs, reduced hours. It became inevitable. That loss of income hit families hard, especially those who are already living paycheck to paycheck.
And I remember all the talk about those social safety nets and whether they were even strong enough to support all the people who were suddenly facing hardship.
It really exposed the gaps and vulnerabilities in those systems.
Absolutely. And it wasn't just adults being impacted either.
Now, the report also looked at how this was going to affect education.
With schools and universities closing, millions of students were forced to adapt to remote learning.
And that came with so many challenges.
Yeah.
Access to technology, that lack of social interaction, the difficulty of trying to recreate that kind of supportive environment that's so important for learning.
I remember those early days of remote learning, just the scramble to get kids online, the teachers trying to figure out how to engage students through a computer screen. It wasn't easy for anyone.
No, it wasn't. And the challenges were even greater for students from disadvantaged backgrounds, those who might not have had the resources or support to really succeed in that kind of environment.
It really magnified those inequalities that already existed in education.
It did.
And it forced us to rethink what education should even look like. How do we balance the need for safety with that importance of social interaction, in-person learning?
Those are discussions we're still having today.
We are, and we can't forget the impact on mental health.
The report highlighted that as a major concern early on.
All that fear, the uncertainty, the isolation.
It had a huge impact on everyone's well-being.
People were anxious about their health, their jobs, their families, the future in general.
It really was a collective trauma.
It was. It really was. The report really stressed the need for mental health support services, especially for frontline workers, people dealing with job loss or financial strain, vulnerable populations.
It's a good reminder that these kinds of events, these pandemics, they don't just affect our physical health, but also our emotional and psychological well-being.
So looking back on this report, it really did give this accurate, if a bit daunting, picture of the challenges that were to come with the pandemic.
It was almost like a warning, but also a roadmap.
A roadmap for how to navigate the difficult path ahead.
Exactly, because it wasn't just about highlighting the problems. It was about providing recommendations for what to do about them.
So let's dive into those recommendations. What did they suggest for China, for countries facing imported cases or outbreaks, for those countries that hadn't been hit yet, for the public, for the global community as a whole?
It's like they were trying to create this global playbook for pandemic response.
Which must have been invaluable, especially for those countries that were just starting to see their first cases.
It was. So for China, they had done this remarkable job of containing the initial outbreak. But the report urged them to remain vigilant. They stressed the need for continued surveillance, a careful, phased approach to lifting restrictions, and a readiness to respond to any potential resurgence.
So even though they had achieved a certain level of control, the threat wasn't over, and they still had a lot to learn, right?
A lot to learn. And they also emphasized the importance of prioritizing research, especially in areas where those knowledge gaps persisted.
Like those questions about household transmission, the role of children, the long-term effects of infection.
All those unknowns we were talking about earlier.
And what about those countries facing those imported cases or those new outbreaks?
The message was clear. Act fast and decisively. Activate those national response plans. Make finding and isolating cases a top priority. Implement rigorous contact tracing and quarantine. They also really stressed the importance of clear communication and public education.
Because people needed to understand the seriousness of the situation, how to protect themselves and others.
Exactly.
So it sounds like the report was basically saying that every country had a role to play, even those that hadn't been hit hard yet.
Absolutely, because for those uninfected countries, the message was preparedness. Review and strengthen those pandemic plans, enhance surveillance systems, make sure healthcare facilities were ready for potential surge in patients.
It was a reminder that no country was truly immune to this new threat.
It was a global problem.
And for individuals, for the public, what did they recommend?
It was all about individual responsibility, practicing good hygiene, staying informed, being prepared to support those public health measures.
Those everyday actions, washing hands, covering coughs, social distancing.
It all made a difference.
It's a good reminder that even in a global pandemic, those individual choices, they have a collective impact.
They really do. And lastly, the report addressed the international community, urging global collaboration and that open and transparent sharing of information.
It was a call for global solidarity, recognizing that a threat to one country was a threat to all.
It was.
It does sound a bit utopian, especially given how much competition and mistrust we saw play out between countries during the pandemic.
It does, but the report really advocated for that coordinated global response, following those international health regulations, coordinating efforts, avoiding those unnecessary travel and trade restrictions that could hinder the response.
So we've covered those knowledge gaps, the recommendations for different groups, the importance of global cooperation.
And we've also talked about the economic and social impacts of the pandemic, how the report anticipated those challenges from the very beginning.
It was a real wake-up call. It urged us to not just focus on containing the virus, but to also think about those broader societal impacts and come up with those comprehensive responses.
It really makes you think about what we can learn from this experience,
Yeah.
how we can use this knowledge to build a more resilient future.
It does.
I think the biggest takeaway is just the importance of resilience, both for individuals and for society as a whole.
We need to be adaptable, resourceful, we need to support each other, and we need to learn from our past experiences.
We have to keep asking those tough questions, even when the answers are difficult.
And we have to remember that pandemics, they're complex. They have far-reaching consequences, and understanding those consequences is the first step toward building a world that's better prepared for whatever comes next.
Couldn't have said it better myself.
Well, on that note, thanks for joining us on this deep dive into the WHO-China Joint Mission Report. It's a reminder that even in the face of uncertainty and challenge, knowledge and collaboration, they're our most powerful tools. Stay curious, stay informed, and stay connected, deep divers.